communicate to the body. Now, I like to give a couple examples too of that innate intelligence, just to really give you a really good understanding of how powerful that is. You think about, a typical example, you get a cut, whether you're cutting some vegetables or whether you're flipping through a book and you get a paper cut. Nobody thinks about the process of between getting that paper cut and a week later when you can't even see the cut anymore. But that entire process was regulated and managed from the brain via the nervous system. Your brain communicated to the skin cells to rejuvenate, it coordinated with the blood cells that were able to form a clot to protect from any germs and any pathogens. That entire process was all controlled, all governed by the brain, this innate intelligence. You think about where each and every one of us came from. A single sperm cell, a single egg. That entire process, they join together, DNA transfers, you have one cell. Then you have 2, then you have 4. Then you have 8, then you have 16, then you have me. Eventually, sooner or later, you get to that point. That entire process is all governed by this intelligence, and it all comes from the brain, and it has the ability to communicate via the nervous system. So when I talk about structure, and when I talk about what I do as a chiropractor, is this bone can go out of place, like I said earlier. It causes immediate pain, usually due to local inflammation. But that's just half of the picture. And actually, that's just a quarter of the picture. What's also happening too, besides that irritation and pain that you're feeling, let's say this bone went forward in your neck, is you're also experiencing a slight compromise in the ability for you to express life at its fullest potential, because you just compromise that nerve. Now, luckily enough for our body, being as genius as it is, you don't just have one nerve running to the stomach, you don't just have one nerve running to the liver. You have a whole set of them because they're very important, and your body's prepared to handle it. But at this point, if you have a nerve, say, running to your liver, for example, being compromised, now your liver is running at, let's say, 90%, let's say 80%. So what does that mean for you? Now your body's not handling toxicity as well as it would if it was running at 100%. This is the soul of why your structure is so important, because your body and what you eat, your body utilizes everything you eat and rejuvenates itself, and that's again why we talk about that being so important. But there's no way to go around the fact that structure causing a compromise in the ability for your brain to communicate and utilize that food, utilize that nutrients. So what I do is I go in there and I reposition these bones back to the ideal position, so that way we can take out the majority of the interference, if not all of the interference, onto that nerve. The other big component that I said that has to do with structure is posture. And I think, like I said earlier, we can relate a little bit more to posture and why it's so important. Well, before I was a chiropractor, I had no idea why posture was so important, like I was telling someone to go and tell you guys that right now. Scientists have found out now that if you take a nerve, you take this guy right here, and they're about as elastic as this material is, if you guys want to feel that after I'm done. But if you take that and you bend it, stretch it, just like that, you are going to get the same net effect as you would if you were to pinch the nerve. And we found this out a lot more recently than we did when chiropractic first came around. When chiropractic first came around about 100 or so years ago, we were just looking at that basic model of the nerve being pinched. But now we know so much more than that. Now we know that these nerves are being stretched, they're being compromised. Your body's ability to function 100% is being compromised, just as if a bone was pinching on the nerve. So, your next question, if you were me, is why is the nerve being stretched? Every time you bend forward, even for 2 seconds, or if you stay at work all day, or if you're stuck in this position, or if your back's actually like that. And what happens to people when we age? What happens to some people as we get older? I can demonstrate. And then your head's obviously not going to be set like that, your body needs to bring your head like this. And that's what you're doing just to function. And the great thing is it doesn't happen to everybody, but it does happen. It's a slow process that happens if we don't address the structure or the structural integrity of the spinal column. When staying in that position of being constantly stretched, like I said earlier, you're not functioning as much as you were. People always ask, well, how come when we're older, you don't function as fast? How come every single thing, generally speaking, of someone is older, that they don't function as well? If you ask me, that's it right there. You know, if your brain's only able to communicate to the body 40% as efficiently as it used to, well, theoretically, it's going to be 40% as fast as it used to be at doing anything. Digestion. It's the body's immune system. You know, energy levels. Everything originates from the brain being able to communicate effectively to the body, every organ in the system. So what we want to do is we want to remove as much interference as possible, get you out of pain, and we do that by taking the bone, taking the pressure off the nerves, and more importantly, restoring the posture to an upright position.
Dean, will you tell them about ABC adjustments?
Yes, absolutely. I do that's actually I'm glad about that. So I do a different technique. It's not as common in this area. So if anybody has experienced a chiropractic adjustment before, I implore you guys to come in and try it out. The great thing about what I do is you don't need a lot of treatments, like they said, to really notice the power of it. And depending on the severity of your condition, you know, it's not always a one-time thing you fix, but it's definitely a lot faster in my personal experience, and it's the reason why I chose this technique, is because I want to make people better as fast as I can. And at that point, when being relieved of your pain and your mental complaints, if you like the idea of functioning optimally, if you want your body to function as good as it did 10 years ago, 15 years ago, you have the ability to continue your care and get visible changes in your posture. What you will notice very quickly within 4, 5, 6 treatments is you'll pop up right. You'll literally be tall, whether it be centimeters, millimeters, and over the course of 6 months, even an inch. Now, an inch is a little bit on the extreme side, but depending on how far ahead you are, you're literally just restacking those bones more vertically. So it kind of makes sense as to why you would get taller. Some would come in a little bit, but that's all the cosmetic aspect of it. The most important aspect of it is you're going to be functioning optimally. You're going to be functioning faster. The other big thing as to why I chose this technique is that with regular chiropractic, I'm not sure if anyone here has experienced this or been told this, but you tend to find that if you don't go consistently, you're not going to enjoy the benefits of chiropractic. How well your body moves, the pain relief, and they tend to come back. That's what I noticed, and that was a big issue, and I didn't want my patients to experience that. With ABC, the technique that's the acronym for it, is you find that you get better fast, and you don't need to be stuck on a continual plan. I don't really do plans in my practice. I tell people to come in, and they come in, and they go for free treatments, and when they're done, they're done. And they ask me, when is the time to come back? And I'm like, you tell me. Like I said, if you're there for pain relief, or if you're there to function optimally. If you're there to function optimally and you want to function optimally, then yeah, you should come in once in a while. You know, continue to stay at that 100% optimal level that you achieve. Well, that's your decision for you to make. I'll end it today by saying that what I'm doing for everybody here today is giving what do I call it? You get a claim evaluation. That's just a fancy way of saying it's a free opportunity to come to my practice, meet my staff, and tour the facility, sit down with me one-on-one, and we'll take a chance to we'll sit down and look at what's wrong and figure out if chiropractic is an option. And then at that point,